Good afternoon, everybody. My name is Tommy Valentine with CatholicVote. We are the nation's largest lay Catholic advocacy organization, along with our friends from Do No Harm and the Pennsylvania Family Council. And for our part of CatholicVote, we represent millions of Catholics across Pennsylvania and the nation, and we speak on behalf of the strong majority of people of all faiths when we say that medical experimentation and exploitation of children at the Children's Hospital of Pennsylvania must stop. Earlier this month, our friends at Do No Harm published a groundbreaking database detailing which hospitals are engaged in the abhorrent procedure of mutilating children who are suffering deeply from confusion and lies about their bodies. At the top of the list was Children's Hospital of Pennsylvania. They're the #1 hospital in the country for children for many good things, and many of us know people who have been helped here. But sadly, they're also on the list of #1 in terms of transing children from Pennsylvania and across the region. According to the database, over 100 children under 18 have been subjected to harmful transgender experiments, including cross-sex hormones, puberty blockers to children as young as 5, even irreversible and damaging surgeries. And in consultation with Do No Harm, we've been able to dig a little bit deeper into that data. And today we can reveal some details on exactly what's being done to children in the walls behind us. We found evidence of 74 double mastectomies of teenage girls and 9 full hysterectomies of teenage girls. Any one of these procedures on a confused child would be a crime. This is an absolute scandal. And I think it's rather interesting that they seem to prey on teenage girls. There were very few males in the data that we found. Everybody knows that teenage girls are very susceptible to this sort of predatory practices, and it's got to stop. And the worst may be yet to come. For our part of CatholicVote, we're going to go ahead and say it. In Kamala Harris and Tim Walz's America, these mutilations would be celebrated, promoted by the government, and paid for by the taxpayers. And the proof comes from Tim Walz's Minnesota, where he as governor signed a bill last year making Minnesota a sanctuary state for child sex changes, allowing the government to take custody of children whose parents object to their transitioning. All a troubled teenager from anywhere in the country has to do is get across state lines, and Minnesota will ensure she can get her breasts cut off. Taxpayers will pay for it. Kamala Harris and Senator Bob Casey will enthusiastically support the transing of children that's happening under Tim Walz's watch in Minnesota, because they want to take the Minnesota bill national. States like Pennsylvania will be required to participate in the trans madness. It's not just wrong, it's evil what's happening to children across the country. And so today we're calling on CHOP to immediately halt all trans procedures being performed on children within their walls. We call on all Pennsylvanians to reject gender insanity by voting against Kamala Harris, Tim Walz, and Bob Casey. And speaking as somebody who has struggled with mental health issues of a different flavor, I speak personally when I say I'm personally offended on behalf of children who suffer from things that I have suffered with in the past that are very similar to what's happening to our children. It has to stop. It's got to stop today. And with that, I want to turn over to my friend Beth with Do No Harm.
Good afternoon. Thank you all for being here today. My name is Beth Serio, and I am here representing Do No Harm, a medical watchdog organization that protects healthcare from consequences of woke ideology and identity politics. We're here to discuss our new initiative, Stop the Harm, exposing the child trans industry in America. This is a first-of-its-kind database launched this month that catalogs child sex change treatments performed in pediatric hospitals across the country. Now, parents, policymakers, and concerned citizens can simply look up their local children's hospital and see what kind of gender medical interventions they are performing on children in the community. These treatments are far more pervasive than the healthcare industry is willing to admit. Nationwide, we identified almost 14,000 children subjected to sex change interventions from 2019 to 2023, and over $120 million in claims submitted to insurance. In Pennsylvania alone, we identified over 800 child sex change patients. Over 300 of these children were subjected to sex change surgeries. These can include mastectomies or top surgeries, but also more gruesome procedures such as phalloplasties that irreversibly damage a child's genitals. The child trans industry can also be a very lucrative business. Pennsylvania hospitals alone submitted over $6 million in claims for interventions during this time period. It is important to note that these figures are just the tip of the iceberg for what's really happening in children's hospitals across the country. And these dollar figures are likely a significant undercount of what the true story is. Our data does not include private payments, claims through the VA, and claims through the Kaiser Permanente system. The real numbers are likely far higher, and our database is providing a baseline to show which hospitals are performing these procedures. But even at this baseline, the numbers are simply mind-boggling. Beyond quantifying the scope of the problem and creating this resource, we want to expose the people and the institutions most responsible for performing and promoting these procedures and prescribing these treatments on America's children. This way, we can exert pressure on the decision makers and prompt tangible, lasting policy changes. In addition to constructing our database, we also profile the 12 worst offending children's hospitals in the nation. These are a dirty dozen. What we found is that many of the most prolific prescribers of cross-sex hormones and performers of child sex change surgeries are also the most vocal proponents of gender ideology. For instance, one of our dirty dozen is the Children's Hospital of Philadelphia, or CHOP, where we are standing right now. CHOP's gender clinic is run by Dr. Nadia Daushin, a gender ideologue who has advocated against legislation intended to rein in these harmful procedures and protect Pennsylvania children. In 2017, Daushin messaged the now Assistant Secretary of Health, Dr. Rachel Levine, to acknowledge that she, Daushin, was not aware of any literature to support child sex change surgeries, but that they were being performed anyway. Indeed, CHOP has seen well over 100 minor sex change patients between 2019 and 2023, including multiple surgical patients. CHOP proudly advertises itself as a national leader in supporting transgender children. But at Do No Harm, we believe that a true leader in the field would guide children towards acceptance of their true selves and not towards irreversible procedures and dangerous medical treatments. We call upon CHOP and all children's hospitals across the country to return to sound, evidence-based medical practice that improves the lives of children in the community. It is time to stop the harm done to children here and across the country, and it is time for these hospitals to be held accountable. Thank you.
My name is Dan Barkowiak. I serve as Director of Communications with Pennsylvania Family Council. And really, I'm representing an organization that's statewide here in Pennsylvania, but I also want to speak as a dad. I'm standing here outside of the Children's Hospital of Philadelphia. I spent 2 weeks at a children's hospital in central Pennsylvania when my son needed heart surgery as a 9-day-old boy. It's a miracle that he's alive now. And what I'm thankful for are the many nurses and doctors, the advancements in medicine that has been made that are looking to help children. They helped my son. What we're highlighting here is there's a program that many hospitals have that are not helping children. These children deserve better. What is being put upon them in terms of irreversible surgeries, cross-sex hormones, these things are not helping these children. In 2017, CHOP lobbied heavily in Harrisburg when it came to taxpayer funding of these types of what they call sex reassignments and transition-related drugs and services. Lobbied heavily to see that funding continue and based it off of the quote-unquote evidence-based research. Well, right now, especially with the CAS review from the National Health Services in England, they found that the evidence is, quote, remarkably weak. We also know that thousands of children have been irreversibly changed
with regards to healthy body parts being removed from their body as a child. You have Chloe Cole, who's spoken out saying how her body is destroyed, her health is destroyed, her just livelihood really has been destroyed. When it comes to the health care of children, we shouldn't be destroying children. CHOP talks about a lot of transforming children's lives. We should be about transforming children's lives in a positive way, not destroying their lives. Funding for these procedures continue. The Pennsylvania Department of Human Services, the millions of tax dollars every year go to these types of drugs, procedures, and surgeries. You know, children at young ages. In 2015, there was just a handful of children ages 6 to 12 receiving quote-unquote sex reassignment and transition-related services and drugs. Today, it's 200 children. The age bracket of ages 13 to 18, what used to be 90 children in 2015 is now 1,900 in 2022. It's just continued to escalate, including the taxpayer funding that we're seeing. They continue to lobby for loosening health standards. You have doctors here that are lobbying for no lower age limit for top surgery. That's not in the best interests of children. You have CHOP focusing on getting into elementary schools, middle schools, to have trainings for staff, teachers, staff, where they're encouraging staff to withhold evidence from parents when it comes to what they're teaching these children. That's not in the child's best interest. Again, 2 of the top 12 worst offending hospitals are right here in Pennsylvania, with Children's Hospital of Philadelphia being number 1. Any medical professional who continues to experiment on a child experiencing gender dysphoria, or any hospital that allows these experiments, is knowingly endangering the welfare of that child and violating their duty to protect that child's well-being. Our health systems are letting these children down. I'll end. There was a press conference in Harrisburg with Senator Judy Ward stating, how much longer will we wait before we step up and do something? How many more children will be butchered and allowed to make a decision that they may regret the rest of their life? Children deserve better. We need to be changing a lot of these policies, and in particular right here at CHOP. Thank you.
Well, thank you, Dan. I want to thank the local Philly media for being here. I want to thank everybody watching at home. We're going to be on top of this issue come Election Day, and then for years afterwards. We're going to make sure this stops. So thank you for your time.